Thousands of people fall each year, resulting in harm, distress, and in some cases, death. While most falls happen in the community, some occur while people are in hospital receiving treatment for other things. Many of these falls are preventable.
Neil, it's Claire here. Are you all right? Where are you hurt, love?
Hospital staff are working hard to reduce the number of falls that happen in hospital and the harm that occurs as a result. The last thing they want is for a patient to fall.
When a patient falls, it just breaks your heart. You get a real sick feeling in your stomach.
And the nurses always feel like they perhaps have failed.
It's very upsetting when our patients become harmed from falling.
Mum's experience was really unfortunate. It was just so disappointing that something so simple was neglected and resulted in 2 weeks of Mum in hospital.
The focus should be to look at how we can reduce injuries from the falls in the hospitals. So it is a major issue in the hospitals, no doubt.
I think falls in hospital are a significant issue. We take people out of their normal environment, put them into a strange environment. We're giving them medications and different things that could increase their risk of falls.
And we bring them into a hospital with many objects all over the place. We've got blood pressure machines, we've got x-ray machines, we've got all sorts of things, unfamiliar objects but in unusual places.
Well, Mum is 93 and she had a fall, which she does have occasionally. And as a result of the fall, she reluctantly went into hospital. She was ready to come home after 5 or 6 days, I think it was, and I had the call to say that she was dressed, ready to go, she'd been discharged, and then within 20 minutes, as I was ready to go and pick her up, I had a call from the hospital to say that unfortunately that Mum had had a fall, and she wouldn't now be in a position to come home.
We have a duty of care to keep patients safe, but unfortunately we don't always achieve it.
And falls is one of the most common ways that patients are hurt, particularly elderly patients when they're in hospital care.
To keep one person in a rest home or a private hospital costs about $30,000 a year, so it is a huge amount of money.
She'd actually fallen in the bathroom within her hospital room. What had happened was that there was a number of items, well I think it was 2 or 3 items of equipment, hospital equipment on the floor. I think it was so cluttered in there that when she came to leave the bathroom she couldn't get out without reversing first, so she had to push the toilet seat that was sitting on the floor, which was the main obstacle, with her foot, and in doing so she lost her balance, fell back and smacked her head on the back of the wall.
We must do everything we can to avoid a patient falling, and when a patient falls, avoid harm.
Research evidence shows that after a major hip fracture, about 25% of the patients will die within the first year after the hip fracture.
Let's have a really close look at what happened and why it happened, and we'll try very hard in the future not to let it happen again.
But there's so many people involved in a ward team that somebody has to take responsibility. So what we've done is made falls everybody's business.
Mum going into hospital as a result of a fall should have put up the warning signs, and that staff should have been taking extra care to make sure that where she was, particularly when she was mobile using bathrooms, was a safe environment.
It is the responsibility of all the people who are looking after that older person who comes into the hospital to do a falls risk assessment at the time of admission when they come into the hospital.
In this region we became aware that we've been all working on falls in different ways, and so we have joined forces and have begun to work together and starting to share and learn from each other.
We just need to have one system, one risk assessment tool to make sure that all the DHBs are following that.
Well, once we've identified the most common reasons or what they're at most risk of for falling, we'll tailor an interventions package to address that. So commonly it may be balance related issues, or reduction in the ability to save oneself if you should stumble or trip. And we would do an exercise program around balance exercises or strengthening exercises, or enhancing someone's ability to catch themselves or save themselves should they stumble. If it was risks related to footwear or glasses or the condition of their feet, we would refer on as it was appropriate to the most appropriate medical professional.
This ward's been involved in releasing time to care, which is a lean healthcare program. So the things that we've done is around the environment. We looked at the patient room, we decluttered equipment and furniture in the room. We've designed and designated bedsides, so we've now got a patient and visitor side and a nurse's side. So that removes hazards when they're mobilising and also equally allows the nurse easy access to emergency equipment and clinical devices.
Intentional rounding is a process that has been implemented in this organisation. What intentional rounding does is encourages the nurses to meet with the patient on a regular basis throughout their shift using intent.
We're quite excited about that because it's going to give more structure to our nursing care, seeing the patients routinely on an hourly basis.
You also use the status bed boards to highlight some of the key areas of concern for a patient in that day. We know that our call bell usage has reduced by 50%.
For Mum, she actually lost her confidence at that point, so when she went home from hospital we had to upkeep her support. So we now have somebody coming in to be there when she showers every single morning, and so we had to spend a lot more time helping her out ourselves as well as these caregivers that come and go.
There's no magic bullet for falls. There's not one health professional that holds the key. It's something that we all have a role in preventing, and we're all as equally as important as anyone else.
It's about the person who brings the cup of tea to the patient. And if they see the patient getting out of bed and they know that that patient is frail or just looks like they might easily fall, that they push the bell and get some help.
Through to the patient's family who play a role in that as well, through to the obvious staff members who have that duty of care and that obligation to do their best to ensure patients aren't harmed when they're in our care.